Good morning, ladies and gentlemen. We are in Doña Ana County today to make an important announcement for this community and frankly for patients and providers across the state of New Mexico. It has come to the attention of the New Mexico Department of Justice that ongoing concerns about management practices and billing practices, and frankly the standard of care that is being provided at Memorial Medical Center is not only potentially in violation of New Mexico law, but from my standpoint and based on the things that I heard today, truly shocking and appalling. I was, I think, shaken by the public accounting and reporting of a couple of patients who I will introduce shortly, and the stories that they recounted about being turned away at a moment that I think every human being can relate to, and that is in a moment where they are scared, they are suffering from disease, they are looking for help, they are looking for treatment. And rather than finding an institution in a hospital that placed their interests first and their well-being first, they were turned away. And they were turned away for financial reasons. That's what brought me to Las Cruces today, is to learn more about their story and about the troubling and concerning allegations that had been made about why they were denied care at one of the two primary medical facilities here in Doña Ana County. So we had an opportunity to meet and learn more in a meeting with a number of stakeholders just prior to this press conference. And in that meeting, there were not only patients, but people who have been connected to Memorial Medical Center for some time, former employees. We heard from providers, we heard from others, and it is my judgment that the facts that were shared with our office just about an hour ago will not only support the announcement today that we are opening an investigation into Memorial Medical Center, but to profoundly expand the scope of that investigation. It is apparent to me that the management of this facility has failed to place the well-being and safety and care of their patients in the proper place and in the proper priority. It is apparent to me that decisions have been made and continue to be made from a standpoint that is primarily seemingly motivated by profit, by maximizing the bottom line, and without due respect and due regard for the patients under their care. The announcement that we make today is predicated on a number of allegations that, if proven, could demonstrate violations of a number of state and federal law, including the Unfair Practices Act, the New Mexico Indigent Hospital and County Health Care Act, and the New Mexico Patients Debt Collection and Protection Act. I am happy to be joined this morning for this announcement by two individuals who I think deserve great respect and appreciation from this community for not only engaging in a battle for their lives and for their health, but by having the decency to identify publicly profound problems with a healthcare institution in this community, not only for themselves, but because they're concerned that others may suffer a similar fate if these issues aren't addressed. And so I'd like to start today by introducing Barbara Corral and Debbie Jo Mincer, and have them share a little bit about their experience with Memorial Medical Center. And then I will introduce and ask members of the local governing bodies, county commission, the city council, to provide their own perspective on what I think is quite clearly an institution in desperate need of reform and correction. And so with that, please allow me to introduce Barbara and Debbie Jo.
Hello, I'm Barbara. I'm a nurse. I've lived here since I was 7. I'm a taxpayer. I was an employee at MMC for 6 years and was proud to be a nurse there. In September of 22, I was diagnosed with vaginal cancer. My medical oncologist called a doctor at Memorial, Dr. Call, and said, hey, I have a nurse for you. This is, what's wrong with her, and let's get her started on radiation. Dr. Call said, okay, we'll get her started. Well, I wasn't probably even half a mile down the road when doctor called me and said, they're not going to treat you because they don't take your insurance. At that time, I was paying $800 a month for my insurance, and I just couldn't even believe that a hospital in my town, my community, where I pay taxes, where I'm a nurse, where I've taken care of so many people, wouldn't provide care to me. I was just shocked. So I ended up going to Albuquerque, and I got amazing treatment. I would never, ever in a million years refer somebody to MMC. I feel like the level of care has gone down. The staff, there's not enough staff for the patient ratio, and it's just an unsafe place to be now. So, thank you.
Hello, my name is Debbie Jo Mincer, and I was diagnosed with breast cancer at the first of the year. I started into my care there at MMC just sort of stunned in general. There's no family history. So I ended up having my surgical procedure and then a follow-up appointment with my oncologist there at the cancer center. And that day I went in and they called me up and said, your Medicaid, I am on Medicaid. Your Medicaid has ended. Do you have any other insurance? And I said no. And they said really quickly, well, we can't see you today then. And I stood there stunned, not really sure what to think or what to say. So I stood there probably 3 seconds, and they turned around and said, okay, and I walked out and spent the rest of the day scrambling, trying to find insurance that I could get in place. That shouldn't happen. I mean, I thought about it after I drove away, and they had told me, and I had met, that they do have social workers on site. They should have offered me that. There was no offer of self-payment. There was nothing, just we can't see you today. And that's something people shouldn't go through when their mind is not right anyway. And it was shocking and scary, and it's just not right.
I'm going to ask members of the City Council and the County Commission to share their perspective, but before I do, I want everyone in this community to think about what it would feel like and how it would impact themselves or someone that they love to be facing a cancer diagnosis and looking for help and getting the kind of response that Barbara and Debbie Jo got. As I said before, I think it violates potentially New Mexico law, but it violates something even more profound in our community, and that is an expectation that we do what we can to help. And I want to take a moment to reflect on something that was shared with us in the meeting with some of the people who have worked at Memorial Medical. And they went to great lengths to ask that I identify their commitment to the work, their devotion to patient care, and for all of us to do what we can to recognize that they want to do the very best by Debbie Jo and by Barbara and by others who are afflicted with this disease. And it is to their credit that some of the providers who shared information with us amplified and frankly identified additional concerns about billing practices at the institution. But perhaps even more troubling, a culture of fear, a culture where providers and employees of the institution, rather than being recognized for raising issues that have been identified for management to correct, they fear retaliation and they fear punishment. They fear that by speaking up, that they will pay a profound price. And I want each of them to know that the announcement today of this investigation should be a signal to them that we will be taking a very deep and detailed look into all of these allegations, but it should also serve as a signal to the management of Memorial Medical that any attempts to interfere with individuals who are associated with that institution and sharing information about its practices will not be looked on kindly and will be dealt with most severely by the Department of Justice. This is a time where everyone who is involved and cares about these issues needs to be centered and focused on one thing and one thing only: what's in the best interest of patients. That's what matters most. That's what we have to prioritize. And that's the nature of the investigation that we've announced today. That's our focal point. But make no mistake, anyone engaged in any form of retaliation against either patients who speak out or providers who speak out will be dealt with by this office and this agency. And with that, I'd like to call members of the City Council and the County Commission to come forward, share their perspective on what this means for the community and the impact that this will have for their constituents, and how I think we can all work collectively to move in a more positive direction.
Hi, good morning. My name is Joanna Bencomo, Mayor Pro Tem for the City of Las Cruces. I am here really on behalf of the many constituents who have reached out to me about their experiences with MMC. Thank you, Attorney General Raúl Torrez and the New Mexico DOJ for being willing to engage in this hard but important conversation with us stakeholders. This process that the AG has started didn't have to be an option. But ultimately, this is what happens when people feel not heard, when real stories and experiences are being outright dismissed. Accountability and oversight are important, and at the end of the day, what is most important is equitable access to healthcare for patients and providers to feel safe and cared for, and for good faith partnerships between community, government, and our hospital. I will continue to work with my colleagues to ensure we are responsible stewards of the lease agreement and that we keep this conversation moving forward. And this conversation must include those who are directly impacted. We want to hear from you. We want to work alongside you as we navigate these rocky waters, and that includes staff. Because as Attorney General Torrez said, some of the staff at MMC are giving their sweat and tears to this community and want to acknowledge their hard work. I am committed to seeing this through because, like I said, this is our community and this is our hospital. Again, Thank you, Attorney General Torrez and your staff for being here. And lastly, I just want to say that somebody I deeply trust and who used to work at MMC called this that's happening right now a moral injury. And that weighed heavy on me. And I feel a deep sense of responsibility as a city councilor and a member of this community to see this through, and you have our commitment. Thank you.
Thank you. Again, first to the patients who have really spoken up here and in other contexts to bring this issue to light, and to the advocates who have worked tirelessly to get us thinking about this. Since the start of these conversations, folks have been coming forward quietly, loudly, sharing that they had their trust broken in our community. And I think that Memorial Medical has been a source of hope and healing for many folks. It's been a place where we've trained many doctors who now serve our community, nurses, phlebotomists. Across the gamut, Memorial Medical is an institution, and I think what we're hearing today is that profits are now the driving force in the decision making at the institution. And I think looking at that from a perspective of someone who listens to community and hearing from all the folks who have been coming forward, who feel comfortable sharing, and those who don't, profits as a primary driver of care doesn't work. And we're expecting more, and we're here to commit to hearing from the community, from the providers, supporting the ultimate outcome, which is restoring hope to the folks who seek treatment at Memorial, restoring confidence and space for the folks who work there to do the best and give the best care that they possibly can. And so I think I share the appreciation for the patients and for the Department of Justice for paying attention to this and bringing it forward. And I hope that we can work together to really change the outcomes and create a place where folks can be healed in a lot of ways. Thank you.
Good morning, everybody, and thank you for joining us. I'm Manny Sanchez. I'm Doña Ana County Commissioner. I want to thank Attorney General Raúl Torrez and the New Mexico Department of Justice for coming forward and bringing this announcement of the investigation into Memorial Medical Center. I especially want to thank these patients, these women, for bravely sharing their stories and standing up for what's right in our community. As a resident here of Doña Ana County, we know, and many people will understand, that medical resources here are limited. And when one of our trusted institutions turns people away, turns you away, that is disturbing and shakes us to the core. Memorial Medical Center serves not just Doña Ana County, but much of those in southern New Mexico. As a county commissioner, I've heard from constituents of cases where service was denied, whether it was because of lack of insurance or inability to pay. One of the key pieces of the county has been our ability to help with pay for services with our indigent fund, to help those residents that are most vulnerable get the care they need. And in cases like this, there have been concerns that where we hear, particularly in cases of cancer and some other treatments, where they've been turned away. And so I hope as we move forward with this investigation, we can find the facts, we can identify how we might be able to work with Memorial Medical Center and this community to move services forward. And I really hope that as one of the parties of the lease agreement of Memorial Medical Center's facility, along with the City of Las Cruces, we continue to work together to identify that path forward. But I appreciate, again, everybody for coming out this morning. I appreciate Attorney General Torrez for his efforts, and especially, again, the patients that have shared their stories with you. So thank you.
So Mayor Pro Tem Bencomo rightly recognized that one of the members who participated and one of the stakeholders who participated in the meeting we just had called this a moral injury. And I can't think of a better way of describing exactly the profound implications of the alleged misconduct that's taken place at the hospital. And moral injury of that type only occurs when there's been a moral failure. And I think that it is absolutely essential for our office, our investigators, and our litigators to get to the bottom of how that moral failure occurred. Because this community deserves better, these patients deserve better, and each and every one of us is entitled to decent treatment when we are confronted in our darkest hour, and that's what's at stake in this investigation. So I consider it to be one of the most profound actions that our office will undertake, and I can assure the members of this community that no resource will be spared as we seek to uncover exactly how this occurred, and we will do our level best to continue working with local stakeholders and patients and their advocates to make sure that this community, once and for all, has the kind of hospital, has the kind of medical services that they're entitled to. And with that, I'll stand for questions. Yes.
While the investigation is running, what will happen to those persons that, as today, need medical treatment in the hospital? If they go and they don't have insurance, are you going to ensure that the hospital will receive them?
We are encouraging any patient who thinks they have been impacted by these management decisions around affordability and accessibility to contact our office, the New Mexico Department of Justice, directly to share that information with our investigators or to contact local representatives, either the county commission or the city council, and they can relay that information to us. This is, at this point, a civil investigation. And we have limited tools, given the pace of the kinds of claims and the kind of procedure that follows from a case like this. But rest assured that we want to hear from anyone who has been or suspects they may have been turned away because of a lack of resources.
But while the investigation is going, if there refuse treatment, they call to the offices and the hospital will have to receive them?
Anyone who reports to our office that a new violation has occurred, will work with our investigators and litigators to craft a response that's appropriate given the particular facts of that allegation.
And as of right now, how many claims have you had, or how many victims?
We've heard from a number of patients, some of which, like Barbara and Debbie Jo, who are willing to step forward. Frankly, we have heard from other patients who were initially denied treatment but have since resumed treatment at the center. And they are, frankly, so fearful of retaliation or disruption in their care that they're unwilling to be publicly identified at this time. But there are several patients and providers, and I anticipate that the list of patients and providers who are identifying issues will grow as this investigation unfolds.
Right now you have an estimate, a number?
We don't have a firm number yet, but we will certainly keep you apprised as the list of identified patients grows and evolves through the course of the investigation.
Do you anticipate this could turn into a criminal investigation at some point, or is it stay civil for now?
When my office organized a visit to this community to have an opportunity to meet directly with patients like Barbara and Debbie Jo, we had a very specific, and I will admit, a much more narrow perspective on some of the issues that had to be addressed at the medical center. Let's just say that based on the information that I received this morning, I can't rule out the possibility of a criminal investigation.
Can you get into more of the specifics about what it is that your office is looking into, specifically as it relates to New Mexico law?
So we are looking first and foremost at the denial of care for individuals like Barbara and Debbie Jo, and the possibility that it's a violation of the Unfair Practices Act. As you are aware, New Mexico has strong consumer protection laws that prohibit the misrepresentation of material facts to individuals who are engaged in the marketplace for goods and services, including medical services. And if there has been a misrepresentation by the facility about its willingness and ability to provide care for indigent patients or patients in financial need, there are a number of state laws that require financial screening. We identified a couple of those laws, specifically the New Mexico Indigent Hospital and County Healthcare Act and the New Mexico Patients Debt Collection and Protection Act. There are, in addition, federal statutes that require accessibility for people that don't have the means or resources. One of the things that is clear to me today, after having a deeper appreciation for not only the issues identified by Barbara and Debbie Jo, that we will be reaching out to our federal counterparts to engage in a deeper investigation into some of the billing practices that, frankly, I was unaware of until today.
And if your office determines that, you guys reasonably believe that MMC has violated some of these, what are the potential consequences that possibly could be facing?
In light of the fact that the investigation is still unfolding, I don't want to prejudge what the outcome might be, but if people are held, if it is proven that they've violated, for example, the Unfair Practices Act in the state of New Mexico, not only would be subject to damages, but there's a $5,000 civil penalty for each and every violation of the UPA. But that's just a single state statute. If we add in violations of other regulations, the financial impact of the institution could be profound. If we determine that individuals have engaged in conduct that constitutes or warrants criminal investigation, then there are a whole different set of outcomes that may flow from that.
Thankfully, these patients did come out, but is there any kind of checks and balances to make sure things like this aren't happening? Are there any policies that are going to change after this?
Well, the ultimate objective of an investigation like this, quite frankly, is not to secure necessarily financial penalties. What the community wants and what the community needs is a hospital that's centered on patient care. And if you listen to Barbara and Debbie Jo and others, the outcome of their experience at Memorial Medical led them to go to other facilities. In Barbara's case, she went to Albuquerque, and I think to UNM.
To New Mexico Cancer Center.
To the New Mexico Cancer Center. And one of the things that came through in that conversation is this is the same patient with the same disease, with the same challenges, and yet the experience that she had at Memorial Medical Center as compared to the facility in Albuquerque was night and day. It wasn't a conversation about how much money do you have. It wasn't a conversation about whether you can come up with money out of pocket. It wasn't a conversation about what kind of coverage your carrier was going to provide. It was a conversation that should be had between somebody who is facing a cancer diagnosis and their doctor, which is, how are we going to make you well? And how are we going to get you better? And my ultimate outcome, my ultimate objective is for Memorial to believe is appropriate, but there are civil and potentially criminal penalties that attach to behavior that is demonstrated to be ongoing and part of a pattern of billing practices that are not supported by CMS regulations and by the reimbursement requirements that are pretty strict for Medicare and Medicaid patients that are under the care of any facility.
Would you share this information with them and see if they are willing to join you guys?
One of the first things that we're going to be doing is reaching out to our federal counterparts to notify them of some of the new information that came to light today, and to invite them to engage in a more thorough process to evaluate numerous allegations of the potential for improper billing and for procedures that may or may not be warranted under this particular diagnosis of particular patients. But that's certainly something that's up to them, it's their prerogative, but we will do everything in our power to involve them, and I think based on what I heard today, federal authorities probably will have significant interest in how this hospital is being managed.
One question for the people standing behind me. I think one of the ongoing questions here about the situation is whether or not Memorial has violated the lease agreement with the city. And so now, I think for people following this story, they're going to look at the situation with the mental health ward. They're going to look at the situation when some of the stuff first came to light with the NBC News situation, and now this. So I suppose, for you guys, like, where are you guys standing on that question of has Memorial violated its lease?
I think we have started these conversations at a city level, and I think that we're in the process of figuring out the different levers of understanding what all is involved in the lease, both as far as care of the patients and the expected levels of care, and the stewardship of the building and the facility that we do jointly own with the county. And so I think the lease is several hundred pages, and I think that we're really committed to poring over that, understanding what role we have in working with the county to hold MMC accountable to that lease. But that process is ongoing and very detailed. So we have a lot to do in that domain, but it's underway, and we've been considering this, I would say, probably for about 6 months. We've been having this conversation very seriously and looking at the documentation within the lease. So that will continue.
When the hospital kind of did its tour of the city council and the county commission, they made a lot of promises about, like, we're going to provide you guys with this documentation and this evidence. Did they fulfill those? Have you guys received that information?
No, they have not.
Thank you very much. If you have follow-up questions, I'm sure we'll be able to help. Thank you.